everybody. I'd like to open the Town of Ayer Select Board meeting for Tuesday, May 20th, 2025. This meeting/hearing of the Ayer Select Board will be held in person at the location provided on this notice. Members of the public are welcome to attend this in-person meeting. Please note that while an option for remote attendance and/or participation via Zoom is being provided as a courtesy to the public, the meeting/hearing will not be suspended or terminated if technological problems interrupt the virtual broadcast, unless otherwise required by law. Members of the public with a particular interest in a specific item on this agenda should make plans for in-person versus virtual attendance accordingly. This meeting will be live on Zoom and Channel 8. The public may access the proceedings by joining Zoom, meeting ID number 978-772-8220, or by calling 929-205-6099. For additional information about remote participation, please contact Carly Antonellis, the Assistant Town Manager, at atm@ayer.ma.us or 978-772-8220 extension 100 prior to the meeting. If you could please stand for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Any amendments to the agenda?
I have none.
Okay, I'll take a motion.
I'll make a motion to approve the agenda as submitted.
Seconded.
All those in favor?
Aye.
Chair says aye. Agenda approved. No announcements this evening. Is there anybody here or online for public input? Okay, not seeing or hearing anyone. Move on to our first item of the evening. It's a summary presentation on the results of the PFAS health study in air. Lori, if you want to come on up, introduce yourself, and then Dr. Shadler, if you'd like to introduce yourself as well.
Thank you so much for having us today. I really appreciate being on the agenda and being able to share this update with you. I'm Lori Nearing. Julie Cornswood is behind me. We've been active with PACE, People of Air Concerned About the Environment, for quite a long time, and both of us have recently retired, and we have new people that are stepping in, but both of us were very involved with the PFAS health study, and we continue to stay involved in that aspect of what we had been doing. And so tonight, Laurel Shader, who is from Silent Spring Institute and helped to lead the study, is here to present a very brief summary of what the study was about, and then to focus mainly on the results as we know them so far. Just to kind of emphasize that Ayer was really fortunate to be able to be part of this study. It is a national study. There are only 7 places chosen across the whole country, and we were one of those 7. And so for no charge to Ayer residents, matter of fact, they got paid, people who qualified were able to get the results of their blood tests back. And you'll see it's pretty surprising to me that we've been learning more and more, over time. And the studies that we're following are showing that PFAS is everywhere. It's in everything. So many products, all of us are probably wearing it right now. And as Laurel will reveal, 100% of the participants across the country have PFAS in their bodies. And so we're concerned about the health effects. And I'm going to close with what I'm doing in the state of Massachusetts to try to help pass some regulations to make some differences, at least here in Massachusetts. So I'm going to turn it over to Laurel. She has a PowerPoint presentation. For those of you who may be joining online, it's very similar to what was shared in advance. There's just a couple of tweaks in the PowerPoint. And I'll turn it over to Laurel. Laurel, you're on.
All right. Terrific. Thank you so much for the introduction, and thanks to the Select Board for accommodating our request to be on the agenda kind of last minute. And really grateful to Lori and Julie and everyone at PACE and everyone in the town of Ayer who was really supportive of this study. Been working with PACE for over 6 years now, back when this study was just sort of an idea. And so happy to have this opportunity to talk a little bit with you about the study and the status of it, and hope to have some time at the end for a dialogue about how we can continue to keep the community updated and any questions and concerns that the community still has. I could talk for a long time about PFAS, but this is a brief update, and I'll share some resources for those of you who are a little less familiar with PFAS and or less familiar with our study and want more detail. First, though, I did want to introduce the organization where I've worked for nearly 16 years now, Silent Spring Institute, which is based in Newton. So I'm glad to join remotely because it'd be a long drive to come out this time of day to Ayer. So we're an independent nonprofit research organization, and we're dedicated to understanding links between everyday chemical exposures and women's health with a focus on breast cancer prevention. We were founded over 30 years ago by visionary activists at the Massachusetts Breast Cancer Coalition who saw the need for more research on environmental causes of breast cancer. So we've evolved into a leading research organization focused on environmental chemical exposures, how we can reduce those exposures to protect health. We continue to partner really closely with Mass Breast Cancer Coalition and many other advocacy groups, including PACE, who help to translate and to have our scientific research have a greater impact. Next slide. So I'm sure this is very familiar to all of you who are sitting in the room, but as you're probably aware, PFAS were first discovered in the town of Ayer drinking water back in 2016. The highest levels found in the Grove Pond wells have been traced to the use of a certain class of firefighting foam at the former Fort Devens site. The Spectacle Pond wells on the other side of town are not impacted by Fort Devens. They have lower levels of PFAS, and we've been learning a bit about where those may be coming from. And so I think an important thing to note, and something that we mention when we're doing our work, is to know that the town of Ayer has done a really great job in stepping up and putting in place filtration really promptly to protect Ayer residents. So the Grove Pond well started to be treated in 2020. And Spectacle Pond wells since 2022. So all water and air is now filtered for PFAS, but because of the past elevated levels, there is concern and an opportunity potentially to learn from those past exposures in terms of how those chemicals can affect our health. Next slide. So what I'm here to talk tonight about is what's called the multi-site health study. So this is being funded and coordinated by the Centers for Disease Control and Prevention, CDC, and their sister agency, the Agency for Toxic Substances and Disease Registry. So the broad goal for this study is to better understand how PFAS exposures can affect people's health. So this study was started actually in New Hampshire at the Pease Trade Port. So ATSDR first did a kind of pilot phase of the study, and then they wanted to include communities in 7 additional states. And so overall, the target study population was 7,000 adults and 2,100 children. We at Silent Spring Institute applied to be part of this study. We were fortunate to meet Lori and the team at PACE around the time that we were putting our proposal together, and it was a really great opportunity and a great fit to partner with the town of Ayer in this work. You can see on the map the other states in the study, so California, Colorado, Michigan, Pennsylvania, New York, and New Jersey. So these are all including, these are research teams working with local communities that also had experienced contamination of their drinking water. Next slide. So our study here in Massachusetts is called the Massachusetts PFAS in Your Health Study. It's based in Ayer and in Hyannis on Cape Cod. So a lot of our work over time has focused on Cape Cod because of elevated breast cancer rates, and our initial human health study that was based there in the 1990s. And Hyannis actually used to have higher levels of PFAS than any other public water supply in Massachusetts. And Silent Spring Institute was first to test for and find PFAS in Hyannis and in other communities on the Cape. So we knew we wanted to work with Hyannis because of those high exposures. And so including Ayer allowed us to have more participants that we could take part in the study. And because the levels in Hyannis were higher than in Ayer, it gave us some opportunities to kind of compare and contrast the two communities. So our study here in Massachusetts is led by Silent Spring Institute. Other researchers on our team are based at the Harvard School of Public Health and a nonprofit organization called the Eastern Research Group. Our local partners in Ayer, as you know, are at PACE, and then in Hyannis, we've been working closely with the Mass Breast Cancer Coalition. And probably all of you in the room received postcards and many, and were contacted by our team in lots of different ways as we were getting the word out about the study.
That's my,
cat.
that's my cat.
and your postcard you got in the mail. Next slide. So just to walk through the timeline for the study, and for those of you who've seen the film Dark Waters, which was about a human health study based in West Virginia, you might remember from the film that it was kind of a long process to go from starting a health study to finishing it and getting results. So this is, I understand that now it is quite a long endeavor here. So we first applied for the study or funding to be part of the study in early 2019, and we were awarded the grant, and found out we were going to be part of the study later in 2019. And then we all know 2020 threw a lot of things off in terms of timing with COVID, and certainly CDC and ATSTR had a lot of challenges on their hands during COVID. So things proceeded a little more slowly at the beginning. It took a while to get all the approvals in place. But by 2021, we had received all the study protocols and kind of the green light to start the study. We had planned to start our work in Hyannis, so we launched recruitment there in 2021, and in 2022 launched recruitment in Ayer. And by 2023, in September, we wrapped up data collection across our two communities, and that's when the whole study ended data collection. And as Lori mentioned, people who took part in the study had the opportunity to get results back of their tests. So for everyone who provided a blood sample, we sent them back a result as quickly as we could get the results back from the CDC lab with the results of the PFAS blood testing, and participants also received the results of clinical lab tests as well. Some of you may remember that last June we had a community meeting where we shared community level findings about PFAS levels in our participants in Ayer and Hyannis, and I'm going to present just a few highlights from that presentation tonight, and I'll share a link with you if you missed that meeting and want some more information about our findings in greater depth. There was a video recording, and our slides from that meeting are available online. So next slide. In brief, we enrolled nearly 300 adults and 48 children in Ayer, and we had kind of a similar number in Hyannis. I think we had about 400 adults and 41 kids in Hyannis. So across our two sites, we had nearly 700 adults and 100 kids in the Massachusetts study. Being a participant involved a few different steps. So we had a clinic in the Neshoba Valley Medical Center medical building where participants would come provide a blood and urine sample, complete a clinical visit with blood pressure, height and weight, that kind of thing. We had a questionnaire for participants to fill out, and for kids ages 5 to 17, a set of neurobehavioral tests as well. And as I mentioned, we tested the blood samples for PFAS and for some clinical lab tests like glucose and cholesterol and thyroid hormones and many other lab tests. And it was quite an effort, and we're grateful to everyone who helped us get the word out about the study in lots of different ways, including at the transfer station, which was a great place to meet people.
I just want to add that when we did our outreach to try to recruit people, adults and children, people generally understood what PFAS was and what the study was all about, the reason for it. And I think that's because of the excellent outreach that's been done by you and the DPW, and people seem to get it pretty quickly. And that was different in other communities. They didn't have that same level of understanding. So we did really well for a small community. I'm really proud of of the success we had in our part of the study. It's really well done.
Absolutely. I totally agree. In Hyannis, even though the levels used to be higher in the water in Hyannis, we definitely found that there were more people who weren't aware of what PFAS were or the past contamination in the water supply. And we're really grateful for the support of the town of Ayer. For instance, the school superintendent let Lori and I come to the first day of the teacher training to help get the word out in the schools. It was there were a lot of things that went really smoothly in Ayer, and we're grateful to everyone who helped with that. So again, when we did our community meeting last year, we had a lot more details about the results. So I just wanted to share a couple of the high level findings here, and happy to answer questions if people want to delve into this more. So PFAS is not just one thing. PFAS are a family of chemicals, and there are some PFAS that show up fairly frequently in people's bodies. As Lori mentioned, every participant in our study had detectable levels of PFAS in their blood, and that's not unusual. The same is true really of the general population. So I'm going to walk you through this graph because I know there's a lot going on here. So what the height of the bars is showing is the median or kind of middle concentration of 4 different PFAS chemicals, and their names are on the bottom. And I'll say that the 2 on the left, PFOS and PFHXS, are 2 PFAS that used to be present in firefighting foams, for instance, at military bases, as well as at certain airports. And these 2 PFAS tend to be elevated in the blood of people in communities where water was contaminated by firefighting foam. The other 2 PFAS can also be present in firefighting foam, but aren't as tightly linked to those types of firefighting foams. And so what I'm showing here are a couple of different things. So there are 3 sets of bars for each chemical. So the Hyannis levels are in blue. The orange bar is the Ayer median level, and then the gray bar is the median level from the US general population. And so if you can go to the next slide, kind of walk you through this. So looking at PFH excess, so that one in the middle, what we do see is that the levels in Ayer, so the median level was about 36% higher than in the general US population. And this, again, is not unexpected because this is a chemical that tends to be elevated in people exposed to water that was contaminated by firefighting foam. It also tends to stay in our body the longest compared to the other chemicals. And we collected our samples in 2022 and 2023, and as I said, the water had already started to be treated, but because it takes a while for these chemicals to be, it kind of gets really slowly excreted from our bodies, we still kind of see this elevated level. As you'll note, the level in Hyannis was quite a bit higher, and that's not surprising because the water there was more severely contaminated. So that one chemical, we did see a higher level in Ayer. If you go to the next slide, you'll see that the levels for the other 3 PFAS tended to be similar or, if anything, lower than the general US population. You might wonder, why would it be lower than the general population? And I think the reason for that really just has to do with timing. So these, what we call long chain PFAS, have been phased out of use in the US. These chemicals do stick around in our bodies, they stay there for a long time, but when you reduce exposure, over time the levels in people's blood are going down. And CDC has done testing in the general US population and shown the levels in the general population are going down. So the US, kind of the reference group, the general population number here comes from 2017 to 2020. And the Ayer numbers are from 2022 to 2023. We've done some estimating. We don't have official numbers from the CDC, but kind of looking at the graph over time, we think that if the US samples had been collected at the same time, that they'd look pretty similar to Ayer. Whereas for Hyannis, we did see that the levels were higher for both PFOS and PFHXS. And again, if you would like some more details about this, I'm happy to answer questions here. And the community presentation we did last year really goes through this in some more detail, as well as talking about the demographics of our 2 study populations. So next slide is about our community meeting, which we had at Ayer High School last June. The video recording from the event is online. You can use that link or scan the QR code. In the picture there, you can see our terrific study coordinator, Emily Heckel from Silent Spring. And so you can, find more resources there about what we presented. So on the next slide, so what's next for the study? So one component of our study, and I think something that makes it unique compared to some other studies that are also being done, is that we have a component to go backwards in time. So when we look at the levels of PFAS in people's blood, 2022, 2023, that doesn't necessarily tell us about who was more highly exposed over the past 5 or 10 or 20 years, or maybe even longer. Because we know people who say lived in Ayer their whole life maybe had higher exposure than someone who moved to the area more recently. So an important other part of our study is groundwater modeling to go back in time to estimate what levels of PFAS were in the drinking water. And we're going back to the year 2000. And then, and for those of you who are in the study know, we had a very long questionnaire and we asked about where people lived and some questions about water consumption, whether people tended to drink bottled water, tap water, whether they filtered their water. And so we're using those pieces to go back in time and try to estimate what people's blood levels were over time. And that will tell us and give us some more ability to really look at these relationships between PFAS levels, PFAS exposures, and the types of health effects that we're looking for in our study. Our community presentation last year allowed us to compare our two Massachusetts communities to each other and to the general population, but we didn't have the results for the other sites to talk about. There is a paper that is close to being published in which we can see how the Massachusetts levels compare to the other communities within the multi-site study, and that should be published soon. And then I've learned a lot because my background is actually environmental engineering and environmental chemistry. I'm not an epidemiologist by training. And so I'm learning a lot about how long it takes to analyze data. There's kind of a lot of behind the scenes work. I won't get into all the details of that. But in terms of the key outcomes that we are looking at, so for our site in Massachusetts, we're leading analyses on PFAS and blood pressure and hypertension, and also on metabolic syndrome. There are also a whole series of other papers being led by other sites within the study, but the data from Massachusetts are part of this, looking at other types of health outcomes like diabetes, cholesterol, cardiovascular disease, and effects in kids. And then we also are digging a little bit deeper among our Massachusetts participants, where we have a little bit more detailed information about their residential history and looking at differences between the participants in Ayer and Hyannis, and also looking at how long do we still see this signal, say for people who always drank bottled water or always filtered their water versus always drinking unfiltered tap water. We still are seeing these elevated levels in Hyannis and still seeing differences as a relationship in relationship to their water related behaviors. And so we have a paper that we'll soon be submitting that answers those kinds of questions.
I just want to highlight that each of these components that Laurel just mentions, they're huge behind the scenes things. You saw the sort of in the face to face part of it when people went in and did their study, but the groundwater modeling just by itself is massive because we had to work with DPW and find out what people drank from which well source and when and how much. So tremendous amount of data digging is going into all of that. It's a lot of work going on here.
Yeah, a lot of behind the scenes. And one component that we're incorporating into our modeling, in addition to going back in time to estimate what the levels were in the Grove Pond and the Spectacle Pond wells over time, we also think that there are some differences in the levels of exposure depending on where in town you live, because the
Yeah.
water doesn't fully mix in one big tank before going into the distribution system. People who lived on the west side of town over time probably got more of their water from Grove Pond wells, and people on the east side of town over time got more of their exposure or got more of their water from Spectacle Pond and probably had lower exposures. And so we're trying to account for that in our modeling. For those of you who'd like to learn more about PFAS, I also wanted to mention an online resource center called the PFAS Exchange. It's got fact sheets that answer the types of questions that I often get from community members. There's a map that shows locations of known and suspected contamination sources all across the country. We've got a tool to help people interpret results of water and blood testing and resources for clinicians. And this is one area where we would like to deepen our work in the community, because often the advice when people get lab results is to go talk to your doctor. And we know that a lot of doctors haven't learned about PFAS before, and may not have information to answer questions from their patients. I know the community of Ayer is in a strange spot right now with the closure of the hospital, and people may be finding different places to find medical care. And so we've created resources, including a continuing medical education course to help clinicians and patients better apply the information about PFAS exposures to include and improve clinical care.
I just handed out one of the fact sheets that is from this database. It looks like a couple of you got an additional one that was sort of mixed in, but you're welcome to have it anyhow.
Thanks, Lori.
Yeah, you're welcome.
All right. So, and then just being mindful of time here. So the next slide, I think it's kind of coming down the home stretch here. So I know everyone, it's hard to avoid kind of listening to the news and hearing about the changes that are coming out of DC. There are definitely challenges for the public health field, as well as for our specific study. So EPA just last week said they plan to roll back some of the drinking water standards. And there's also talk of undoing two PFAS chemicals being part of the Superfund CERCLA law. So that's worrisome to me. I think in Massachusetts, even if the federal standards get rolled back, we had standards here in Massachusetts going back to 2020. So I think the regulators here are more on top of this, but I worry about this patchwork, across the country, where some states, that means their residents won't be protected. And it's so frustrating because it was so much work and so much science that went into the development of those standards, and to see those being rolled back is disheartening. So I hope that won't really happen, but I'm not a policy or legal expert. For us as an institution, we get over half of our funding from federal research grants, and so that seems like a challenging path moving forward. We're in a little bit different spot than the big universities, but it's still hard. There's a whole network of researchers that, over time have always relied on the availability of federal research grants. They're still really hard to get, but
Yeah.
they've always been there. And so I worry about what that means for the future of public health research. So far, the staff for the study at CDC and ATSDR are still, in place, but I think it's a really challenging time for our friends in the federal government. The study officially ends at the end of September, so and it still feels like there's still a lot of work to do, and there's a lot more that we can learn from the results that we have. And as we think ahead towards finishing the analyses and publishing them, and to be really credible and carry the weight to inform future policies and regulations and laws, research needs to go through rigorous peer review. And because this is funded and is a partnership with these federal agencies, they have to go through a clearance process. So far, there hasn't been any challenges with that, but it is a worry. And then again, I don't know how much time we'll have here, but just some discussion questions. Are there ways that we can work together? How would you like to hear updates about the study? There won't be one report, there won't be one thing, and then okay, we're done with the study. It's going to be this progression of research findings over time. Some things that will be led by our team in Massachusetts, some things that will be led by other sites, but will include Massachusetts data. So we want to know how to share those results. I'd like to hear about them. And as Lori said, PFAS are in everything. They're hard to avoid. We all have them in our bodies. So are there other questions or concerns that you have? And with that, Lori, I think the next slides are yours.
Yeah, and the questions that you may have, you can reflect back to either Laurel directly or to me. I know we're a little bit over our time, and I value your time. One of my concerns is that my levels are higher than my personal levels are higher than the medium, quite a bit higher, and I have always filtered my water very carefully. I'm very meticulous about it. So what's going on with that? You know,
Showered?
um,
Do you have,
or-
so is it,
it doesn't so
did you-
much. Yeah.
No, what I'm saying is that, do you have like a whole
No,
house-wide
it's
filter?
a drinking water filter.
Yeah, because I mean, you might have drank some of it. I'm just thinking out
Yeah,
loud, you know?
yeah. Or the filter that I was using wasn't working.
That too,
Yeah,
that too.
Yeah, one of those things. So, since we're going over time, I'm just going to pass this out quite quickly. We can go to the next, yeah, this is, what's up there is the same as this. So I mentioned that I became involved through this work with Laurel with a whole range of nonprofit organizations. All their emblems are on the back of the page there. And so we've been meeting once a week, once every other week to try to work with the state legislature to get some regulations passed. This flyer is actually from last year. We didn't quite get it to the floor last year. We're hopeful we'll get it this year. So we're working with Senator Julian Sear and Kate Hogan, Rep. Kate Hogan. They're both wonderful. We're working hard to get it on the floor. So I may come back and at some point and ask for your support in writing a letter to help get this to be passed. Especially since the EPA is backing out of its regulations, we need to protect our citizens. And as we've been saying, it's in everything. We need to stop using it. It's in so many products where it's not necessary. It's a convenience factor. And you'd be surprised, you'd be shocked. It's in so many things we put on and in our bodies, including children's products. And there are a few things where it's necessary, a few medical things, but I would love your support down the road to push this forward. And I'm guessing that we're all in favor of this. We're calling it casually turn off the tap. So that's what we really need to do. So be happy to answer any questions, but we're over at this point. So if you want to follow up at some point later, we could do that as well.
Thank you, Laura.
Thank you.
Thank you. Laurel, do you have any questions before?
No, I thank them very much for this.
Okay. And I have another meeting at 7, so I'll stay for a few more minutes.
Okay.
Meeting hopping tonight.
All right. Thank you very much. Appreciate it.
Thank you. And my email address is on the last slide, so if anyone wants to reach out or have some more questions, please do reach out. Hope to see you in person next time. Thank you.
Great. Thank you so much.
Thank you, Laurel.
Thank you. Great. Next up will be our town manager's report.
Oh, we got ratification.
Oh, sorry, skipped right over.
Time?
In the interest of time, I skipped over the. Next up, our ratification of appointment of the new Economic Development Director, Rachel Friedlander.
Mr. Chairman, members of the board, good evening. Through you, I'd ask Ms. Rachel Friedlander to come up to the table.
It wasn't on purpose.
So it gives me great pleasure this evening to introduce to you Rachel Friedlander and to respectfully request your ratification of her appointment as the next Economic Development Director for the town of Ayer. As the board is aware, when the position opened, the town advertised the position in the Massachusetts Municipal Association website, the town's website, social media, the Indeed online advertising, in all of the venues we usually use. We received 10 applications for the position. I put together a screening committee consisting of the assistant town manager, the town planner, the DPW director, the program coordinator, and the chair of the planning board to screen the applications and to conduct the interviews. We interviewed candidates, and without question or reservation, it was unanimous to recommend Rachel for this important position. I also followed up with all of her professional references that she provided that were glowing and spoke very, very highly of her. The board has in your packet her letter of intent for the position as well as her resume. And I just want to add a couple of things that really stuck out Rachel's candidacy. As you could see, first of all, I just like the sentence that she provided. I believe strategic planning is one of my strongest skill sets. As a leader, I can think quickly, bring multiple stakeholders together, and lead with vision which really stuck out. She holds a bachelor's degree from Berkeley in conservation resource studies. This Saturday, I understand she'll be receiving her master's in public affairs from Brown with a focus on democracy and human rights. As you can see in her letter, she has not only extensive experience, but a track record of securing CDBG funding from her work in Alaska. And of course, Ayer is also a CDBG community. She also speaks to interest and expertise in the IDFA, which we would like to get back up and going, the Industrial Development Finance Authority, which is key to the town. Also, the TIF, Tax Increment Finance Review Committee, extensive credentials in land use and economic development, a communicator, an advocate, grant writing, again, solid track record there. And overall, I think that she will be an excellent addition, not only to the team at Town Hall, but to the town of Ayer. So, Mr. Chair, without further ado, I recommend enthusiastically the ratification of Rachel's appointment as Economic Development Director at grade 12, step 3, later this evening, subject to the ratification of the personal service contract. And with that, I'll turn it over to you, Mr. Chair. And Rachel, any questions that the board may have for Rachel, or anything Rachel, through the chair, would like to add? And her effective start date would be July 1st. So thank you.
What brings you to Ayer from Alaska?
I know.
think that's what everyone is.
That's a great question. I also just wanted to say to the select board, feel free to call me Ray. Of course, you can call me Rachel, but I also go by Ray. I'm very lucky to have family in Ayer, so I grew up coming here. And when I was thinking through this next decade of my life and prioritizing aspects to a good life like family, I was looking for an opportunity where I could live close to family. And that's how I got out of Alaska, first for grad school and then to find a new place to call home.
Impressive. I mean, I am just looking at the job titles. You know, city manager, executive administrative assistant, lands and resources specialist. I mean, legislative aid. I mean, you know, what a find. You know, I think this is going to be awesome.
We'll make it awesome. I mean,
There you go.
I was telling, I feel like I need to speak very highly of your town manager after such an incredible introduction he gave of me, but I'm really looking forward to seeing what we can do together because there is no silver bullet. It's definitely, government is all about service. And so let's just see what we can do together, not just as this immediate team, but with the community. I'm really curious to learn what folks think about Ayer and to just approach it as open-mindedly as possible with a lot of curiosity to see what answers we get out there about how people see Ayer growing into the future.
It was mentioned about grant writing. You know, one of my things with grant writing is not worrying about the percentage that you get, but striving out there and trying to grab even ones that are maybe far-fetched, you know, but possible. So what is your thoughts on when you go for grants as far as, you know, kind of the percentage of whether you get it or not, or just trying to reach out to every possible area?
So I learned this concept called opportunity cost. And so when you're saying yes to something, that means you're saying no to a lot of things. And especially at a time when we're actually seeing the grants and outside funding shrinking that's available for municipalities to tackle the challenges and opportunities of their community, I think we have to be very strategic and actually pursuing the ones that we're very confident we'll get. Of course, aspirational is great. I mean, that's why I'm very curious to learn through the manager what the select board members' priorities are for what we want to see Ayer accomplish, but in the short term, I think you have to be very strategic about where you're going to get your yes from, because there's going to be a much smaller pool that we're looking at into the future.
I like that. It's a good answer.
Any other questions?
Have any?
No, I think she's going to be a welcome asset.
Yes.
Thank
I
you
can
so
see
much.
people behind you nodding their heads. Yeah.
That's how it was during the interview too, I can tell you that.
Yeah.
A lot of nods.
Yeah,
So
I
it
can
was
tell.
a pleasure
Yeah.
interviewing Rachel.
Yeah.
She's gonna be a great fit here.
Yeah.
For sure.
All right. Okay, with that, then I will take a motion.
I'll make a motion that the select board ratify the appointment for the Economic Development Director, Ms. Rachel Freiland. Did I say that right?
Friedlander.
Friedlander, thank you.
Seconded.
All those in favor?
Aye.
Chair says aye. Welcome.
Thank you so much. Thank you.
And she's Ray. We'll call you Ray.
Yes.
Yes.
Thank you.
Okay, now to the town manager's report.
Mr. Chair, members of the board, I know I have a 4-minute penalty. Apologies. Just briefly on the administrative update for this evening, and you have the town warrants in the packet that were approved since the board last met. Just a few things onto the administrative update. We had I want to thank the board and the finance committee and town meeting for their continued support. We had a very successful town meeting with all articles passing, including the budget. For the June 3rd meeting, the passage of the citizens petition, which asks the select board to do some research on the, which passed to make a recommendation on the town meeting counters. I'll have a framework for your June 3rd meeting as to how we should proceed in doing our due diligence on that. So more to come on that front. We also had a successful election on May 13th. A special thanks to the town clerk and her team. Congratulations, Mr. Chair, on your re-election. We're now in the fiscal year end, so as in previous years, effective June 1st, any expenditures over $1,000 require pre-approval. That's designed to ensure that budgets remain in line as we close out the fiscal year. I'm also pleased to report that along with the towns of Groton, Harvard, and Shirley, we secured a shared energy manager that will be grant funded for 3 years that will work with the 4 towns on further energy issues as part of the whole green communities. There's no cost to the town of Ayer, and there's also not an expectation that at the end of the grant, this will somehow become a position. It's a 3-year commitment to, and what's of key interest to Ayer, because Chuck Schultz, the facilities director, has done a really great job with the energy issues in the town, is that this will focus on the schools. So more to come on that front. On May 14th, Town Council did the open meeting law training, which was successful. We had about 30 people attend between Zoom and in person. The board has that presentation, which we'll continue to share with folks as we move forward. Tomorrow night at 6 o'clock in the Great Hall is the 71 Sandy Pond Public Design Meeting, as the board appointed the working group to develop a recommendation for 71 Sandy Pond. This is going to be a public design exercise tomorrow with the consultant. We encourage folks to attend. And then we anticipate in the near future the working group having a recommendation or recommendations for the future of that site. Memorial Day, per the American Legion, we did hear from them. There's not going to be a parade this year, but they are planning services this Saturday, May 24th, as follows. Woodlawn Cemetery at 8:45 a.m., St. Mary's Cemetery at 9:15 a.m., and then out here in the Veterans Memorial Garden at Town Hall at 10 a.m. And of course, that is open to the public. And that's my report. I don't have any action items tonight unless there's any questions from the board.
Nope. Nope.
All right.
None.
Next up is new business select board member questions. Didn't have any. Next up, approval of meeting minutes for May 6, 2025. No edits or changes.
No, I didn't see anything. I wanted to make sure the new manager at Alltown, his name was spelled correctly, because
Oh, yeah.
that was a little
The
thing.
I,
but-
not the L.
Oh,
Yes,
yeah.
yes, but it was in the record, so we're good.
All right. I'll take a motion on that.
I'll make a motion to approve the minutes from May 6, 2025 as submitted.
Seconded.
All those in favor?
Aye.
Chair says aye. And it's approved. Brings us to reorganization of the select board. Thoughts, feelings?
Do you have any?
Well, I mean, in the past, you know, we've been willy-nilly, and I don't like willy-nilly. Actually, it just caused me distress. Or, you know, you just kind of rotate. You can rotate, you know, this direction, or you can rotate in that direction. So, I haven't been chair for a while, so, you know, I don't mind being chair unless you really want.
But you can certainly be chair. I don't.
He sounded really eager about that.
It's one of those things. I just figure, like, I just finished my first term, and you know, either it's fine with me either way. I don't have a burning desire, but if no one else wanted to do it, then I would certainly do it. So.
So, do you want to be vice chair? You want to be clerk?
Oh.
Do you want to be vice chair? You want to be clerk?
If you'll be vice chair again, I'll be the clerk.
Okay, that works fine for me.
All right, so I'll make a motion that the board reorganize to board member Livingston being the chair, board member Tavares being the vice chair again, and myself being the clerk.
I will second that.
You're still chair. You have to call the roll.
All those in favor?
Aye.
Chair agrees. Former chair.
Yes.
All right.
With that, Mr. Chair,
Yes, please.
I'd like to make a motion that the select board move into executive session pursuant to Mass General Law, Chapter 30 Alpha, Section 21 Alpha, Exemption Number 2, Non-Union Personnel, ratification of Economic Development Director Personal Services Contract, and that the select board not reconvene in open session, but to adjourn from executive session.
I'll second.
All those in favor?
Aye.
Chair says aye, and we're in executive session.